wearing my hat at the free clinic where we deal with providing health care to folks who don't have any insurance, I'm so aware of how broken this healthcare system is that we have. Because the reality is, even sometimes with insurance, you don't get the care you need. And if God forbid you have a pre-existing condition and you somehow lose your job and then you try to get insurance, no insurance company is going to take you. And there are more bankruptcies occur in this country because of healthcare and the cost of healthcare than any other reason for bankruptcy. So it is really important. Here in California, with the budget crisis that's happening, the governor is proposing such draconian slashes to healthcare, taking away healthcare for children, for healthy families, which provides healthcare to low-income children, taking away that program, taking away dollars that go to clinics to provide healthcare for adults, taking away health care for people with HIV and AIDS, taking away preventative care. It's really amazing. And taking away the dollars, really wanting to cut in half the dollars that the state spends for family planning services. California will deal with its battle this year, and hopefully we win some, but there certainly needs to be a national solution. You should be able to know whether you're working or not working, that you have health care. You should be able to know whether you live in the state of California or you go to Utah or you go to Illinois, that you have the health care that you need, and it doesn't matter when you get sick, that there is going to be a safety net for you.
President Obama's organization has created a video for us to watch, so we'll take a look at that and hear what the president wanted to share with all of us. Towards the tail end of the video, they also talk about some next steps, and we'll walk you through that this afternoon, the conversation for what we'll do next.
In the coming weeks and months, Congress will be engaged in the difficult issue of how best to reform health care in America. In the last 8 years, premiums have grown 4 times faster than wages. And in each of these years, 1 million more Americans have lost their health insurance. It is one of the major reasons why small businesses close their doors and corporations ship jobs overseas. And it is one of the largest and fastest growing parts of our budget. Given these facts, we can no longer afford to put health care reform on hold. And partners have already stepped forward who have never worked together before. But the most important seat at the table belongs to you. To get this done, I need your voice to be part of the debate.
So if you want to take a few minutes and jot down your story and what it is about healthcare that makes healthcare a priority for you.
Well, I was born in England and raised in Australia, and I have grandchildren that live in Australia, and I would love us to have similar health care that both those countries share, which is basically free health care from the day you're born till the day you die. And people are not as stressful about getting ill. Problems with seniors are not as death. You know, they don't affect people as much. It is a simple thing to go to the hospital to get care, to pay for your medications, and I'd love to see that. This country deserves to have a similar health care.